Hi, my name is Ela and I just had my first baby at King's College Hospital. After a lot of research, I was lucky to find Dr. Gowri. I chose her to be my OB during my pregnancy. Having a good relationship with your doctor and trusting them is important, and Dr. Gowri gave me the confidence since the first moment. Her incredible knowledge and skills are nothing short of amazing. Soon after getting pregnant, I started experiencing morning sickness, which was getting worse every day, turning into hyperemesis. So my first 20 weeks were very difficult, but Dr. Gowri was very supportive during this period, and she made sure my dehydration and nausea were under control without further complications.
Ela had a condition called Hyperemesis Gravidarum. This is a condition which is unique in pregnancy. It causes nausea, vomiting. Some people call it morning sickness, although it can happen in the morning or it can happen in the evening. So quite specific to the first trimester of pregnancy. And generally after the first trimester, the symptoms abate and you don't have any further nausea and vomiting. The condition sometimes is associated with a vicious cycle of nausea, vomiting. You get dehydrated. With the dehydration, the nausea and vomiting get worse. You become what's called ketotic, or you have ketones in your urine, a sign of dehydration. And with Ela, what we did was we got her into the hospital. We gave her some intravenous fluids to hydrate her. That broke the cycle of hyperemesis, and she did get better quite quickly after the initial admission.
By the end of the pregnancy, her careful examination and attention to details showed issues with my placenta, which unfortunately could affect the baby. Despite this condition, I always felt supported and comforted by her and the lovely nurse Janice.
Ela also had a condition where the placenta started failing a little bit earlier than normal. The placenta is the lifeline, if you like, between the baby and the mother. And sometimes the placenta that's meant to last a period of 40 or 41 weeks, the function of the placenta reduces a little bit earlier on. And that involves a balance. Is the baby better inside the uterus? Is the baby's placenta providing enough function, or is the baby better out? So with Ela, we ended up having quite regular assessments, regular scans and regular Dopplers. Dopplers is basically looking at the blood flow through the umbilical cord of the baby. And then at one point we decided, it was time for the delivery.
Dr. Gowri's close monitoring and full care assistant helped me reach my due date when she decided that the safest approach is to deliver the baby by induction. As this being my first time going through labor and birth, I naturally felt worried and scared, but Dr. Gowri's impressive skills reassured me, and I knew I was in the best possible hands. My birth experience was far more positive and memorable than I could ever expect, and Dr. Gowri delivered our sweet baby boy healthy, and she made the whole process as smooth as possible. I'm immensely grateful to her, Janice, Emma, Lara, who was the midwife on call the night I gave birth, and all the team at King's College, who made my pregnancy journey the best experience I ever had in my life.